My name's Evan Collins. I'm the North American delegate on the NGO delegation to the UNAIDS Program Coordinating Board. I live and work here in Toronto, Canada. I'm a person living with HIV. I'm also a doctor who works in a sexual and reproductive health clinic, and I work with a number of NGOs on the community and regional AIDS response. For the last year and a half, I've been the North American NGO delegate on the UNAIDS board. And as many people know, UNAIDS is the only United Nations body that has formal representation from civil society, community, and the NGO world. Some would say that the International Labour Organization has some representation through trade unions on their body, but it's UNAIDS that really has formalized this representation. There are 10 of us, one delegate per region and one alternate. And the purpose, written into the constitution of UNAIDS, is to bring the voices of people living with HIV and communities affected by HIV and the NGOs that are working representing those people to the board of the UNAIDS, which otherwise is comprised of 22 national governments or member states and the co-sponsors who make up the United Nations Global Program on HIV and AIDS. There are only 10 of us, so our biggest challenge is how we can truly represent the voices of people living with HIV and the people who work with them and represent them, how we can truly represent the communities affected, especially the really marginalized communities who are so often so marginalized that they are underground. So this is our challenge. We're trying to, through our website, through our communication facility, through our consultations that we do, and through regional work with our constituencies to ensure that any position we take on the board of UNAIDS is informed by not just our opinions, but by a broader input from community. It is a challenge, and we're seeking to make that better. And that's one of the promising things about the IMAXI Cooperatives initiative to try and make the work of UNAIDS, and in particular the governance of UNAIDS on the board, more democratic and more transparent.